This is the first video on the Irritable Bowel Syndrome and will both be an introduction as well as a discussion on symptoms. Is a condition that affects the large intestine. The large intestine or colon is about 5 feet long. I will use the abbreviation IBS throughout the presentation instead of Irritable Bowel Syndrome. IBS is a functional disorder that is characterized by chronic abdominal pain and altered bowel habit. Functional disorder means that it is a problem with the movement of the intestine rather than any damage to the tissues of the digestive system. Investigations done will be normal, showing that there is no underlying damage to the organs. It is estimated that between 5 to 10% of the population suffers from irritable bowel syndrome. In fact, it is the commonest reason for patients to consult a gastroenterologist. Irritable bowel syndrome can go for months and years. It is a chronic and intermittent condition, sometimes with days when the patient does not have any symptoms. It doesn't kill the patient but can affect the quality of life. It doesn't affect life expectancy or lead to other serious illness. When does a person suspect the irritable bowel syndrome? If one suffers from stomach pain for 6 months or longer, together with a change in bowel habit. For diagnosis of IBS, the patient must have abdominal pain and bowel change occurring once a week for the last 3 months before seeing the doctor. This change in bowel habit could be diarrhea, constipation, or intermittent diarrhea with constipation. In intermittent diarrhea with constipation, the patient has diarrhea on some days and constipation on others. The pain is usually over the lower abdomen or the whole abdomen. It is less likely to be in the upper abdomen alone. The stomach pain is less after passing motion. However, sometimes the opposite might happen as the pain may get worse after passing motion. Let's now talk about diarrhea. Diarrhea is defined as a passage of 3 or more liquid or loose stools per day. The diarrhea is often worse in the mornings. The first stool might be formed, but the subsequent stools become watery. Meals can also trigger diarrhea. It is rare to get diarrhea after going to bed at night. There is also incomplete bowel evacuation, where the patient has to go several times before they are satisfied that the bowels are clear. Stools are often soft, broken, or liquid. Sometimes a slimy liquid called mucus is noted in the stools. There is a lot of gas, feeling of being bloated, and belching. Constipation can also be the main symptom. Constipation occurs when a patient has difficulty in emptying the bowel. Some will describe hard stools, others that opening the bowel is too difficult or too infrequent, and some will strain to pass stools, and others feel as though they cannot empty the bowel. By definition, constipation is said to occur when a person opens their bowels less than 3 times per week. Sometimes the main symptom is 1 or more days of diarrhea, which are followed by 1 or more days of constipation. Sometimes the diarrhea and constipation can occur on the same day. Doctors have classified IBS into 3 types. In all the 3 types, the patient will experience stomach pain or discomfort. The additional symptoms are altered bowel. These types depend on whether diarrhea or constipation is the main symptom. Sometimes it could be diarrhea on some days and constipation on others. These are the 3 types of IBS. IBS-D, where diarrhea is the main symptom. D stands for diarrhea. IBS C, where constipation is the main problem. C stands for constipation. IBS M, where both diarrhea and constipation are the main problems. M stands for mixed diarrhea and constipation. Doctors defined IBS-M as when more than 25% of the time the patient has diarrhea and more than 25% of the time the patient has constipation. So from the main type of altered bowel, the doctor and patient will know what type of IBS they have. Also, there are good and bad days. Sometimes the patient may be symptom-free for a few days. Some people are at an increased risk of developing IBS. Younger people are at a greater risk. It is rare to get IBS after the age of 50. IBS is more common in females. IBS is more common if one or more family members have IBS. IBS is more common if there is a history of severe food poisoning. IBS is commoner in those who experience anxiety, depression, and post-traumatic stress disorder, and sexual, physical, or emotional abuse. So, in these conditions, there is an increased risk of developing IBS. There are also other medical conditions that are commoner in IBS. The underlying problem could be a hypersensitive nervous system and an increase in sensitivity to pain. This includes fibromyalgia, a condition where there is pain and tenderness in muscles and joints all over the body, together with tiredness. Chronic fatigue syndrome, where there is extreme fatigue and tiredness where no specific medical cause can be found. Non-ulcer dyspepsia, where a patient suffers from indigestion where no specific medical cause can be found. Acid reflux, frequent headaches, pain over the lower back, discomfort during sexual intercourse in women, difficulty in sleeping, anxiety, and finally depression. As mentioned earlier, the underlying problem could be a hypersensitive nervous system and an increase in sensitivity to pain, which I will discuss later.